A trip to assess the impact of APEAL III project by CEPADWN with funding from ECHO through Care International in Uganda. CEPADWN is a voluntary non-profit making organization that works to resist violence, transform conflicts, and build peace in their communities. It was founded in 2014 by Ugandan women who have worked in conflict zones for more than a decade and are scholars of peace and conflict management. CEPAD, with funding from ECHO through Care International, has been implementing a 10-month project called Access, Protection, Empowerment, Accountability, and Leadership for the refugees and host communities in Imvepi Refugee Settlement. APEAL III is a consortium project focused on protection of refugee persons in the settlements located in southwest and northern Uganda. APEAL III started on 1st May 2021 and ends on 30th April 2022. The project is funded by ECHO. Care International is the lead of the consortium. Other members include International Rescue Team, IRC, Save the Children, Watch Child Holland, Humanity and Inclusion, Umena Uganda, Transcultural Psychosocial Organization, that's TPO, Uganda Law Society, Kabarole Research and Resource Center, Days for Girls, and Community Empowerment for Peace and Development. The main objective or goal of APEAL is to deliver a comprehensive, evidence-based, and people-centered protection, gender-based violence prevention and response, mental health and psychosocial support response for refugees from DRC and South Sudan, as well as host communities in Uganda. CEPADWN worked with women, girls, men, and community leaders and other duty bearers to address women and girls' protection challenges related to menstrual health management, sexual gender-based violence, and their rights through risk communication and awareness creation, capacity building of women, girls, men, and community leaders to address issues of protection, menstrual health management support, women and girls' economic empowerment, and advocacy. 3,000 girls and women positively received and are using antibacterial bee-free caps in Imvepi Refugee Settlement and host communities to manage their menstrual periods. Teachers and community leaders have been trained and are now using skills of menstrual health management in the schools to help the school-going girls to stay in school. Many girls who would have otherwise engaged in risky behaviors because of lack of support of menstrual health management now have a full focus on their education. Girls can now talk freely with colleagues and communities about menstruation. 60 women have been equipped with skills in hand making of reusable pads, crafts, and supported with startup materials to make and sell for income that can be used to improve their livelihoods. 12 extremely vulnerable individuals were identified, assessed, and supported with basic needs and referred to different protection partners for specialized attention. Some of them were referred to HI, and HI visited them and made assessments on them. We had 2 mental disorder referred to TPO, and the clinical officer from TPO visited and made assessments. We also had advocacy campaigns using radio talk shows and meetings with duty bearers, which have increased the knowledge and awareness of stakeholders on instruments, frameworks, and policies for MHM in Uganda.
They train us if you're a girl child, you should know how to protect yourself. You should have a vision for a future. You should know how to talk with the people and how to solve the problem in the community. Shepherd train us on bee-free cap, how to use the bee-free cap. After that, and they distribute for us this one, bee-free cap. Also in that training, they give us some money. Most of the girls, they don't know the advantage of education. Most of them, they are now going back to school due to the training we got from the shepherd. And I'm requesting donor to add them more funds so that they support other girls also in different zones. Somebody who gives you knowledge is better than somebody who gives you money. In our local language, we used to say somebody who teach you how to fish is better than somebody who gives you fish. Because if you know how to fish, you will be earning more than. That's why I say so. Thank you.
I'm happy with my team from CEPAD. First of all, allow me to talk about what happened before this project of menstrual hygiene management meant for our girls and our women in the community. From the beginning of the project, we had meetings, we had trainings with a team of CEPAD, where we experienced a lot of skills developed through the trainings. And before we could get to these trainings, we had a lot of challenges for our girls and our women in the community, particularly the girls who are in schools. Sometimes, it's a taboo. We felt it is a taboo in Africa to talk about menstruation in particular, because this has created a lot of gap for the girls in schools and in the community, because when they experience it, they feel they isolate themselves from the community, other community members. So therefore, with the intervention of this project of CEPAD, they trained us to talk about it openly, to talk to girls, to talk in schools, in meetings about the pride of having menstruation for the girls themselves. So unique, they also introduced what they call beef-free cups for the girls. These are cups that they use, they insert into their private parts to keep them healthy when they menstruate. So before the project, our girls had problems, and we as parents, as community leaders, we also had problems because we are supposed to take care of the girls, both in schools and in community. And the cost of taking care of a girl was too high for us. To some extent, we could not afford to give to the girls.
Yes, you're welcome to Window International Uganda. My name is Ben Anguma, the settlement manager for Window in the Imvepi Refugee Settlement. Yes, I want to appreciate the great work of CEPAD that implemented a menstrual management, hygiene management project in a Imvepi Refugee Settlement. We are very much grateful to the organization to support our girls in school who were having challenges with the menstrual hygiene in the settlement. With the support of CEPAD, the girls were trained through the teachers who were initially trained, and then the knowledge was transferred by the teachers to these learners. This was so much invaluable, reason being that before the training, before the support of CEPAD, many of our girls used to abscond, miss classes because of issues to do with the menstrual hygiene. But after the training, the teachers transferred the knowledge and skills they acquired to build the capacity of the girls to learn how to manage their bodies, especially during the time they are experiencing their periods. So after the training of CEPAD, the girls were able to receive this new knowledge and skills to manage their bodies, and we have observed that the number of girls missing school as a result of menstrual hygiene or menstruation in general has greatly reduced, and this is highly attributed to the skills they acquired through their teachers with support from CEPAD. I want to appreciate CEPAD so much for this support, and we hope that their donor keeps supporting them, because in education, new girls will going to enroll into that age bracket. So I appreciate CEPAD, and I appreciate their donors for the great contributions to the girls, especially in the settlement. Thank you so much.
Thank you so much. I'm called Faith Achiro, the Deputy Head Teacher of Ikuru Secondary School in Imvepi Refugee Settlements, one of the catchment areas where CEPAD has really done a lot. On menstrual hygiene, before the coming of CEPAD, girls could not manage their menstrual hygiene or how to handle their menstruation periods in school easily, because one, they would shy coming to school, and two, when they're in school, they would not be lively in class because they would think anything would happen anytime. And when CEPAD came in to check on the menstrual hygiene in school, they managed to train teachers. I am one of them. All the 15 schools in Imvepi all had representative of teachers in terms of the senior woman teacher and the senior man, who were trained to handle girls on menstrual hygiene, and we were trained as teachers to make reusable sanitary pads as a school on our own, and this helped us a lot. I really thank CEPAD for all these efforts that they have carried to make the girls alert that menstrual hygiene is not a sickness, but it is what its nature, that we can go with it because every woman goes with it. So I really appreciate CEPAD for that, West Nile. Thank you so much.
I'm called Nema Marashto, and since I came to this camp in Zone 4, before, the first partners which came to see us was this shepherd, whereby we passed through many trainings. There were 4 trainings we passed through. One was about gender-based violence, whereby they taught us about how to handle our husband and how to care about our home and our family. And the second training was about making pads, whereby we can even make our pads by ourselves without even quake. We cannot even spend money by buying pads because now we are trained.
During the implementation of APEAL III project, we also had some challenges. For example, adolescent girls from the age of 9 to 24 years benefited from MHM kits. However, majority of them were left out because of resource constraints. We also had 900 adolescent girls from the host community who benefited from the MHM kit, but some of them were also left out because the number was overwhelming and the MHM kits could not cover the entire population in the host community. CEPADWN would like to appreciate Care International for their support by bringing up CEPADWN in the implementation of APEAL III. CEPAD also appreciates the consortium partners for their high level of coordination and cooperation during the implementation of the project. And lastly, we would like to appreciate our funder, ECHO, for making the implementation of the APEAL III project possible.